Everybody. My name is Garrett Schmidt, and I'm the CEO and managing editor of VBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by Calcium Health. And this one's very exciting, and I've been looking forward to this one a lot. And it's called GPTs, Agents, and AIs in Healthcare, Risks, Pitfalls, and Best Practices Safeguards for Value-Based Care Organizations. And I got a little sneak preview of what we're going to be discussing today. So again, very excited about what's going to be covered. A few items of note as we get started. Everyone has joined today in listen-only mode. So if you're just joining us for the first time, this is kind of a traditional webinar format. So we can't see you or hear you, but we do want to hear from you. And so we're going to have a time for some audience questions throughout the presentation today, specifically in one part of the presentation. But if you have a question at any point, go ahead and drop your question into your control module. There's a place specifically for those questions. And we're going to get to as many as we can. We have a big audience today and a lot of questions coming through, I'm sure. So if we don't get to your question, don't worry. Someone will make sure to reach out afterwards. So go ahead and drop it in, even if we're wrapping up at the very end there. Also, today's session is being recorded. So when we conclude, maybe about an hour or so afterwards, you will receive an email, and that email will have a link to today's recording, as well as to the slides. And the slides you're definitely going to want to download because there's a lot of great information there, and you'll see that as we move forward here. So you'll have that to reference. Finally, without further ado, I will introduce our speaker today, and then we can get started. So we have with us Mr. Ray Villar, and he is the Digital Solutions Architect with Calcium Health, and he will introduce the session today and be our guide. So welcome, Ray.
Thank you, Garrett. Thank you very much, everybody, for joining us. Really excited to be here. Yeah, as Garrett mentioned, I am the Digital Solutions Architect here at Calcium Digital Health. What that basically means is I am the resident geek. In fact, just focusing on ChatGPT and AI, some of you may know this already or remember this, but GPT came out the Friday after Thanksgiving 3 years ago. And now, again, being a geek, I had heard about rumblings about it on different boards that I'm tech boards I'm on, online boards. And when it came out that Friday after Thanksgiving, I jumped on it, opened up an account, a free account at first. And over that weekend, I think I only got about 10 or 12 hours of sleep the entire weekend because I just dove into it. It was amazing. I was just, I just ran it through its paces, tried different tricks and tools, even looked at automating it. And it was just an incredible event. And the Monday after that Thanksgiving, that ChatGPT 3.5, that was the first version that became available to the mass public. I put together this lengthy memo for our leadership team here in Calcium, and I told them this is going to change everything. Some of the projections that I had was that, look, this is able to code probably 85%, can actually do 85% of our coding support and needs and fulfill that, which meant that we won't need as many coders. Now, I know that's good and bad. But at the same time, it allows us to do more with what we have without having to add more people. And I told them from a marketing standpoint, because I'm also in charge of marketing here at Calcium and product marketing, that is probably going to magnify. It's going to be a force multiplier for us. It'll magnify our productivity twofold, threefold, tenfold. And within 3 months after ChatGPT 3.5, we actually started rolling out and testing using AI in our platform. And we'll talk more about that later towards the latter part of this presentation. But I am the resident geek here, and I'm as excited about this as everybody. And again, this is something that's very near and dear to me. And this presentation, again, an early version of this presentation, I actually did at a conference in about 3 months ago now, and we're actually going to, and I've actually been invited to another one in January. So this is something that I'm very excited about, willing to share, and always looking forward to discussing more with others who are involved in healthcare and especially using AI in healthcare. Now, with that, I want to start by, again, introducing myself a little bit. I am the digital solutions architect here. In addition, I was an adjunct professor at University of Wisconsin Stout for information and communication technology. And I've been in the digital health and health technology field for over 2 decades, both in the payer and provider space. There's my contact information for my email and LinkedIn, and I'll have this again at the end. And as you can see, there's 2 pictures of me. One, as you can tell, is the real one, and the other is one that I had GPT create a version of me for a romance novel. And as you can see, there's some striking differences. But again, it's not that AI generation is not perfect, but you can see the potential, the possibility, and that potential is just increasing every single day. Now, our agenda for today, I do want to first talk about GPT, what it is, what's involved with GPT, and really give us a good understanding of what it can do and what it doesn't do. And it's going to be important. And then from there, I want to talk about the 4 biggest risks involved with GPT today and AI in general, really. And we'll talk about GPT safe use cases for healthcare and healthcare providers and payers and even pharma and others involved in the healthcare industry. But then we're going to talk about AI agents, and this is where it really takes us to another level. And this is where I get really excited and things that I'm involved with in other study groups and research in AI. And then we'll have some organizational recommendations and have an actual QA session. We'll also have some next steps and final takeaways that I want to review with everybody. And then, of course, if you'll allow me, I do have a shameless plug about the Calcium Digital Health Platform, which includes a provider dashboard, comprehensive tools for providers and patients as well. And with that, let's go ahead and jump into this. And it probably, I probably don't need to explain why this matters, but just in case it's not clear, AI adoption is accelerating in all areas of healthcare. We're seeing this everywhere. I was just reading an article, I believe it was in the New York Times the other day, that there is an AI boom going on right now, and it could be an AI bubble, but it's not like the past web bubble that we saw in 2000, for example, because this is funded not by startups, but actually by a lot of industry have really bought into this. And within this AI adoption, momentum and the movement that we're in, GPTs have been really the first mover, and it offers enormous potential for us for efficiency, documentation, but it also poses a lot of risks for misuse, especially in healthcare. Because it introduces a lot of clinical, legal, and operational risks for everybody involved, and so it's important for us as in the healthcare industry to understand how to use these tools safely. But I do want to repeat, again, as I mentioned, I was at an AI and healthcare conference a couple of months ago, and somebody from Stanford, another AI researcher at Stanford, and I had a really good discussion, and he brought this up that, from their research, from what they're looking at, it's important to remember that AI is not going to replace healthcare professionals. Instead, what AI will do is it'll allow healthcare professionals who understand and leverage AI to replace healthcare professionals who don't. What that really means on a practical level is that AI is going to become table stakes, if not now, it will be in the near future for everybody involved in healthcare. And with that, let's start by talking about what GPT really is and what it isn't. So GPT stands for Generative Pre-trained Transformer. Okay, and I want to focus on the generative side because what GPT does is it generates content, whether it's images, videos, or text. And it's pre-trained. What that means is it generates content based on a knowledge base it has. Now, what OpenAI has done with ChatGPT and what others have done as well is taken this page out of Google's search engine and has scoured the web, and it's just absorbed and digested content from all over the web. Now, GPT, OpenAI, especially the parent of GPT, had a leg up on everybody. It partnered with Microsoft, with GitHub and Copilot, which has been around for almost a decade now, for over a decade. And what it does is that a lot of developers, coders, use GitHub and Copilot to ask questions. And the community of developers around the world actually share suggestions and advice and feedback and analysis. And what happened is that GPT, or namely OpenAI, devoured all that knowledge, all that content. And so from a coding standpoint, they're really amazing because they've harnessed and essentially grabbed all that information from software engineers around the world from the past decade or two, and that's part of their knowledge base. But they've also gone on to search all available websites out there to really build up its knowledge base. But it's, but the key thing here is that it produces human-like text and images based on patterns. So it doesn't really analyze. It doesn't think in the way that we think of a supercomputer to think. What it does is it basically creates sentences. It's one way to look at it, and it figures out what's the right word to put in here. And it's gotten really good at that using what it's called its transformer algorithm to really sound authoritative, and in many ways sound really good. I'll give you an example. We'll touch base on this. Is that emails? I remember it would take me an hour to craft a really good email because, especially if it's an important one. Now I can have GPT create a killer email for sales, or to promote something to somebody, or actually to advocate a case or a proposal even within the organization. It can create this masterful email better than I could have ever done it. But it's just really about building sentences and building paragraphs and building pages of content, whether it's images or videos. It's not perfect, but it sounds really authoritative because it does have that knowledge base that is built up informing it. And then the beautiful thing about it too is that it now you can add personality to it. One of the popular but smaller GPTs out there is Grok AI, which is part of Twitter. And that kind of is a little bit different from ChatGPT because Grok intentionally adds a little bit of personality to its responses. And you can do that with GPT, but we'll talk more about that later. But the important thing to understand about GPT is that it predicts language, not facts. It predicts language. And we'll talk more about this later when it comes to hallucinations. Now, the most popular GPTs today the most popular is still ChatGPT. It was the first one out the gate. Everybody really, dove into it. Today, they have over 900 million users average per month. Google Gemini is in second place, but it's a distant second place. Its monthly user numbers are about half of what ChatGPT has. And Google's numbers are padded because Google Gemini is now part of Google Search. When you actually use a Google search engine, it plugs into Gemini, and you'll see that in the search results that before the organic rankings that we used to really strive for in SEO, you have the AI, the GPT answers from Google Gemini. Microsoft Pilot is doing the same thing now in Microsoft, and Microsoft Copilot especially is critical. Is important for a lot of Azure users. Businesses that use Azure instead of Amazon Web Services or Google Cloud. That's all. Microsoft Copilot is built into that, so it helps coders and developers using Azure, and so you have that really nice synergy, and that's allowed Microsoft to really build up its base quickly. Meta is also coming on board, really coming on, especially because they've applied Meta AI to answer questions, not just on Facebook, but also Instagram and WhatsApp, which is owned by Meta, and other Meta platforms as well. And then you have the rest out there. Now, I do want to point out one on this list that you may or may not be familiar with, and that's called DeepSeek. Now, this is based out of China. And the reason why I'm really keeping an eye on this is, one, it hasn't been used, it has been made publicly available in China itself. It's been limited use. But here's the thing about DeepSeek. It launched last year. and this is, and as some of you may remember, we put the White House, the federal government, put a lot of limits on the exportation of critical microchips for AI to China. And so DeepSeek and other Chinese AI companies don't have access to the most recent generation of and the highest and the best AI chips out there. And so what DeepSeek did is use basically older, 2-3-year-old chips to create DeepSeek, but they did it, and made something more efficient, more energy efficient, more productive in many ways, and cheaper than what OpenAI had with ChatGPT and what Gemini and Microsoft had with Copilot. So it's really an interesting thing. I'm really keeping an eye on DeepSeek because especially globally, and especially once it becomes openly available throughout China, if it ever does, because it does pose a danger, if it starts answering questions in China to, people living under communism, that, hey, there's questions, it might have answers to questions that they don't want asked. But DeepSeek has some incredible potential there that I'm keeping an eye on. Now, before we go further, I do want to do a quick poll on asking everybody here, and if you could just take a few seconds. Garrett's going to put kind of show the poll that we have going on. Now, what GPTs have you all been using right now, especially in the healthcare area? Give 5 choices there: ChatGPT, Claude, Google Gemini, Grok, or Microsoft Copilot. Would love to hear what you're using right now.
Yeah, and you will see this pop up on your screen. And if you're just joining us, and we'll do a couple more polls throughout, and these are anonymous. So but these are just for fun. But we'll show the results so you can kind of see where you stack. And if there's one that we haven't mentioned here, go ahead and drop it in the chat. I'd be curious to see what those are. I know it gives us only a limit of 5 to put on here, so I know we're leaving a bunch of them out. But we picked the 5 that we thought would be the most used. And I'm personally a ChatGPT and Copilot guy myself, but I'm excited to learn about some of these other ones.
Yep. All right. While you're doing that, I'll go ahead and keep going. We're talking a little bit more on assessing GPTs. First, are the strengths and weaknesses. The strength side, and any of you who've been using this already have seen this. It's great at summarizing. I mean, you could feed it a whole book and can summarize, provide you basically, and I might be dating myself here, it can provide you cliff notes in seconds about that book or essay or articles. In fact, I have GPT do this on a regular basis. It can draft care plans, scripts, and even educate, health and literacy, health education materials for you. Create a lot of patient engagement content. And it can automate time-consuming communications, whether it's coming up with the right messaging to send to somebody, so that you're making sure you're clear but effective. And this really does work. I mean, it's amazing how my emails have actually improved, but my email writing time had really reduced significantly. And same with other messages, important messages I have to craft. But there's also administrative efficiencies that GPT offers. I'm able to create more content, videos for marketing, for example, or explainer articles, explainer videos. I'm having it, it actually helped me with this presentation, for example. I had the topic in mind. It helped me kind of create the outline and then make suggestions, and then allowed me to then fill this out and create this in PowerPoint. But you can actually have it create PowerPoint files for you. I had it do it for me many times, but I don't like its current iteration. So I end up doing this myself, but you can see the power in this. Now, some key weaknesses, though, is that it's still prone to hallucinations. Hallucination basically means that it makes things up. It's improving. 3 years ago when GPT came out, about 10 to 15% of things it produced, content it generated, made things up, made facts up, especially. Today, that's down to under 3%, but it's still there. And there's the reasoning is not always consistent. The logic flow doesn't always fit together, because again, it's not a reasoning tool. It's a text generation tool, a content generation tool. And it'll oftentimes invent citations. In fact, interesting story, my wife is a DA, assistant DA in Wisconsin. So she's a prosecutor, been a lawyer for almost over 15 years now. And we're talking about this, and I know the legal community is very hesitant about using AI and relying AI. And I told her, she was looking at kind of putting together questions for her voir dire. If any of you familiar with voir dire, it's where lawyers in a trial are able to screen potential jurors by asking them questions. And so she had this DUI case, and she needed help with voir dire. And I said, use ChatGPT. And it came back with great suggestions. Anyway, she was just amazed at the awesome ideas that it provided. And then, she said, well, maybe it'll help me with my closing argument. And it created a great closing argument. But I warned her, check those cases it cited, because it invents, it has a problem with inventing citation. And so she checked the citations, the cases that ChatGPT cited. And this is the most current ChatGPT. I think this was 5.0 a few months ago when she did this. And almost all of those out of those 10 citations or so, 9 were actual cases, but they had nothing to do with the argument that was created by ChatGPT. It just invented that citation, or grabbed any citation and used it. And then the last 1 or 2 of those citations were totally made up. They didn't exist. Now, and so that is one of the big dangers with GPTs, and we'll talk more about that later, and how to address it and how to solve for it. The other thing too, and this is very important, is that GPTs are not automatically HIPAA compliant. In fact, most GPTs that are available out there are not HIPAA compliant. And we'll talk more about that shortly. And there's also the risk of embedded bias. Because as I mentioned before, GPTs rely on the knowledge base it's built up. But you've all heard that term, garbage in, garbage out. And so depending on the knowledge base it's built up, it may have the biases, whatever biases that knowledge base has becomes part of those whatever that GPT generates. So we have to be careful about that embedded bias, especially when we start talking about health equity and social determinants of health. That hasn't been a strong point of GPT's knowledge base yet, and that's something that it needs to keep learning more about. So with that, let's talk about the first risk for GPTs and AI in general, and that's HIPAA and privacy violations. Because here's the problem. If you're using GPTs, for example, to kind of get ideas for particular patients, guess what happens? That information you put into ChatGPT for that patient goes to OpenAI's database. It trains their knowledge base. So you basically are sharing your PHI with OpenAI and ChatGPT, or whatever GPT you're using. And the problem is that, and this is something we researched from the very beginning when GPT 3.5 came out 3 years ago. It's like, all right, can we get OpenAI to sign a BAA, business association agreement? And they wouldn't, and none of the GPTs would. Now, there are ways around that, which I'll talk about shortly. And in fact, GPT does sign BAA in some cases, but it has to be a special contact. But if you're using GPT for healthcare to help you get ideas for a patient, be careful. And you might even want to stop right now, because unless it's a secure GPT, you're basically sharing your PHI information and helping train the knowledge base of that GPT. And so you have to be very careful. Be very careful about that, because you're intentionally exposing PHI in your prompts, the prompts that you add into ChatGPT, Grok, Copilot, or Gemini, whatever you're using. Now, some basic precautions that you want to do is make sure you use only HIPAA compliant systems. So, for example, we're on the Calcium Digital Health platform is built on the Azure HIPAA compliant server system. And one of the things they started rolling out a year and a half ago is actually a HIPAA compliant version of ChatGPT and OpenAI. And what makes it HIPAA compliant is that the data that we put in there, the prompts that we use, don't get sent back to OpenAI. Essentially, they basically have localized a version of ChatGPT just for us. And you can do this with many other GPTs as well. Not all of them, but a lot of them you can do that, and it kind of localizes that. And so when we feed prompts into that GPT on that HIPAA compliant ChatGPT in our Azure environment, we're able to keep all that knowledge base internally. It pulls knowledge base from OpenAI's general library, but it doesn't send any information back to them when we do it internally. And then if you are using GPT, even when you're doing it internally, but especially if you're doing it externally, make sure you de-identify it completely. Not just whenever possible, but all the time, especially if you're using a non-secure GPT. And of course, you want to train your staff on this prompt hygiene. If you haven't already, when you're doing your annual HIPAA training, you need to incorporate more and more of this. And I think a lot of the HIPAA trainers are already doing this, but make sure you do have that train staff to understand if you're putting patient information into a ChatGPT prompt, you're basically are exposing PHI for that patient. And so you might want to make sure you ensure proper technical and administrative safeguards, and we'll talk more about that later. And so I gave an example of how we're keeping making sure that we're not breaking HIPAA on our end, is that we basically use our own HIPAA compliant AI and version of ChatGPT, segregating it using Azure's OpenAI HIPAA compliant version of OpenAI. It costs a little bit more, but again, it prevents the disclosure of PHI that, of course, we all have to be worried about in the healthcare industry. Now, the second risk I've mentioned are hallucinations, which are, and basically what it comes down, hallucinations are fabrications that GPT, as it's generating content, to make it sound authoritative and convincing and correct, it fabricates and creates incorrect or completely false outputs. And so they're misleading because, as you all have seen, as you're getting content from ChatGPT or Google Gemini, when you're doing a Google search, it sounds pretty authoritative. It sounds convincing. And that's what makes it even more dangerous, because it's misleading. Because and especially in the healthcare industry, it can introduce us to clinically unsafe misinformation. And we have to be very careful about that. Now, this is an important thing to understand, though, about these hallucinations. They're not glitches. They're not bugs. Okay, they're expected behavior of GPT. Remember, GPT is not there to on its own to deliver facts and factual analysis. What it's there for is to generate authoritative and deliver content. That's part of that are part of their expected behavior. So hallucinations are not bugs; they're actually a feature of GPTs. They're an annoying feature and they're a problematic feature, but they're not a bug, technically speaking. They're part of the expected behavior of GPTs, if you really think about it. Now, from a healthcare standpoint, we do need to figure out, how do we address this? How do we fix this? How do we solve for this? Because it is a powerful tool, but we don't want it leading us down the wrong path. Well, there are safeguards we need to use that we can use and we should be using when it comes to safeguarding against these AI hallucinations. First and foremost is we need clinician review, especially when it comes to providing diagnosis or content that's shared with a patient or is used to actually develop a treatment or care plan for that patient. That's why, again, as I mentioned before, AI is not going to replace healthcare professionals. Rather, what AI will do is it'll allow healthcare professionals who understand AI and can leverage AI to replace those who don't. And that's not a new story. We've seen this in technology and and innovation over the past decades and the centuries, that those who are able to apply and the most recent innovations and technology oftentimes outpace those who don't. one other thing too, a second precaution is never use GPT for final clinical decisions. And this goes in line with the first one, that don't just take that, that GPT output and say, all right, this is it. No, it's always a recommendation. It needs human review, a clinician review to finalize that before going forward. And always try to use a structured AI environment whenever possible. What that means is that want to make sure it's built for what you're doing. For if it's a healthcare question or healthcare challenges, you want to make sure you have an AI, healthcare informed AI environment. And one of the things that helps is to build internal templates that you can then reference. And so instead of GPT going into its knowledge base or other, essentially its version of Wikipedia, to come up with recommendations or even ideas for clinical treatment care plans or treatment plans, for example, or suggestions. If you actually build out an internal template or proven content, you can train your GPT to just use that for your recommendations. Use that your library, internal library, to create treatment plans. It can still use other things, but they'll prioritize the content you have in your library. In fact, that's one of the things that we do in our, one of the things the Calcium platform does, among other things. We integrate with Epic, Cerner, and all the major EHRs, but we also integrate with hundreds of medical devices and wearables. But the magic really happens for Calcium is that we take your care and treatment plans and turn it into digital pathways. But we use AI to generate recommendations for those care and treatment plans, and then turn them into those digital pathways that are assigned to your patients. But we always require clinician review and approval before those care plans are turned into digital pathways and then are assigned to a patient. But then we also have a resource library that you can upload content, and our AI studio can prioritize the content in that library, those templates that you have in there, and the guidelines that you have in there, as it creates those recommended care plans and treatment plans, and also as it builds out the the digital pathways that are eventually assigned to a patient to continuously guide them. Now, moving on to risk number 3, and this is AI bias and health equity concerns. And I mentioned this a little bit earlier, is that oftentimes underserved populations do receive biased outputs because it's garbage in, garbage out. And this is especially true in with value-based care quality metrics, is that if you don't screen, if you're not looking out for potential AI bias for health equity, regarding health equity, but also social determinants of health, it can really skew your results and your quality metrics if you're relying too much on AI. Now, one of the ways to really guard against this is, again, make sure you have clinician review of AI-generated patient content, and have bias audits. Have somebody there available who can actually look for potential bias and use structured, clinically validated pathways. Now, one of the interesting things that I think it's a Sharp Health was doing this. It was Sharp Health or Stanford Health. Again, I was discussing with the presenters at this conference I was at a couple of months ago. But one way to address this, and we've started actually looking at this also using this at Calcium, is to essentially create adversarial AI. What that means is that if you use one GPT to create recommendations, use another AI with an AI agent, for example, and we'll talk more about that, to review that finding and determine whether or not it's accurate, it's correct, and it makes sense. Just to give you an example here, let's say you have ChatGPT generate a recommendation or report. With adversarial AI, what it can then do is then use another AI like Microsoft Copilot or Grok or Gemini, with prompts to review for reliability or bias. You basically feed that recommendation report into this other AI and let that do kind of tear it apart and see if it makes sense. And then you could submit it to a third one, all the results, and basically, create an updated report based on the results from the original report or recommendation, and then the critiques and reviews from that second AI. And And again, this is one of the things that are being developed now to lower the case, not just of AI bias, but also hallucinations. So, and errors, potential problems and complications. This is one way to use AI, different versions of AI, to fact check and kind of create some checks and balances to improve. Now, it'll never be perfect yet, or at least right now, but it'll decrease that hallucination rate, for example, down to less than half of 1% potentially by doing this, and maybe even lower by actually doing that. So I'll going back to that example that I gave earlier of my wife, who's a assistant district attorney. One of the things that she could do with her case studies, for example, is that after let's say ChatGPT creates a closing argument with cited cases, she can have Microsoft Copilot actually go into those and find those cases that were cited and analyze whether or not they fit, and then go into Google Gemini and rewrite that argument with newer case studies that could actually fit. And sometimes you might have to do this 2 or 3 times, do this whole cycle, but the end result is you get something more accurate and reliable. Now, risk number 4 is that we do have there's a potential, and we're already seeing this, an over-reliance on automation. Using GPTs to draft, especially without any oversight, just go ahead and create it and then publish it and send it out. You've all heard the stories about lawyers, using ChatGPT as early as 2 or 3 years ago to do their arguments, and it's full of errors because they just assumed that that these AI generated content is accurate. And it's especially dangerous, in healthcare, that assuming that AI generated, especially GPT content, are medically accurate. You can't. As we mentioned earlier, it's besides being prone to hallucination and bias, that's not really what GPT is about. So you have to be very careful that you want to have that you want to automate that AI triage to make sure you're able to spot misinterpretations and misinformation. And some, again, for safeguards, again, you got to keep the human in the loop. You have to have clinical review with, before that final draft. But at the same time, you can limit GPTs, and it does a great job on the drafting side, on the summarizing and the scripting. But again, the final result has to be done by a healthcare professional. It kind of reminds me of and again, I'm a foodie. You have chefs, for example, who have a whole team, creating, their recipes. But at the end of the day, that head chef is the one who has to taste them to make sure that it actually meets their guidelines, meet their requirements, their standards. And again, even at Calcium, we require clinician review and approval before recommended care plans are turned into digital pathways. If you want to see that, we have Courtney on as part of our panel here. She's one of our she is our senior account exec here, senior account executive here. She can show you how that works, but I'm not going to go too much into that. The other thing that we do with Calcium is that we can actually set alerts, based on the feedback, based on priorities set by providers as the data comes in from the digital pathways. And again, we'll talk a little bit more about that later. But with that, I wanted to talk about, there are some safe use cases, and I've kind of touched on this a little bit earlier, that we can already do right now. For example, drafting general patient health literacy and patient education content. There's actually, it's actually ChatGPT and others are really good at this. You still need to review it, obviously, and proofread it, but some of the stuff they're creating is amazing. Also summarizing long documents. You get a report. You get the the New England Journal of Medicine subscription content coming in. Instead of reading through everything, you can have it summarize all that content, make it easy to absorb and absorb all that information. And then also, as long as when it comes to creating non-PHI content, GPT is great at it. There's also, again, for administrative automation, to create your reports for you. create articles for you. So just to give you an example, if you need to do a year-end report, for your team, if you have all the data available, you can punch it into ChatGPT and it create the draft of that report for you, save you probably 2 or 3 days of doing it yourself, and then really just focus on editing, proofing, and finalizing that content. And then lastly, we use this a lot, is it can draft digital pathway content for us. What our digital pathways are really your care and treatment plan turned into digital form that can then be assigned to a patient's app to continuously guide them. And we've, again, a few months after ChatGPT 3.5 came out 3 years ago, we already were working on this and rolled this out to allow us to do that with using ChatGPT and OpenAI to start building out these digital programs to continuously guide patients. So healthcare providers are able to manage and guide dozens more patients that they normally can do using AI and using automation. Now, with that, I do want to do a quick poll here, and I kind of want to ask you, what is your organization's policy towards using GPTs today? Do you encourage usage? Do they discourage usage, or is there even no policy at all?
All right, just like before, you'll see this up on your screen, and choose one of these. And if you're joining us later, these are anonymous. We'll have one more poll before we conclude, but these are just for fun, and we'll show the results here in just a second. What is your organization's policy towards using GPTs? Is it encourage, discourage, or is there no policy at all?
Yeah. And I see a few people have noted that their organizations have actually built out their own. Like we have Catherine Johnson mentioned that about Chat BDO. So, and you do have organizations doing this. We're actually doing something very similar as well on our end. We have our own custom GPTs that I've trained with everything about our platform. And it's been great because it answers questions, for our users, our own team, for example, as we bring in new hires. But it also helps me with, I also use it when I create presentations and reports for internally.
Okay, so let's look at the results here. Looks like most folks have voted, and looks like 39% of you encourage usage. That's great. Have your organizations encourage the usage. 11% discourage the usage, and 50% of you have no policy at all in this regard.
That's great. It's a good place to start.
That's right.
All right. Now let's talk about AI agents. This is really taking it to the next level. GPTs have been around, as I mentioned, since for over 3 years. Well, been around for a while, but it really burst on the scene 3 years ago, the day after Thanksgiving, 3 years ago. But last year, a couple of years ago, we started seeing the emergence and the widespread adoption of what are called AI agents. And this is very important because AI agents are not GPTs. In fact, they move beyond traditional GPTs. And by the way, I did kind of take a pause when I was writing this, and I kind of put in there traditional GPTs, and I'm thinking it's kind of weird to talk about GPTs as traditional when they've only really been around for mass usage for 3 years. But that points to the pace of evolution and development and changes and improvements in AI. But AI agents, so, are not GPTs. They use GPTs, they employ GPTs, but AI agents are autonomous systems that act. So they don't just generate content, they don't just generate text or images, they actually can do stuff for you. And I'll give you some prime examples of that. For example, they can monitor data for you. So as data comes in, you can have an AI agent actually monitor it instead of a human person, actually monitor it, interpret signals, and trigger actions. And that's something that we're actively already kind of working on here at Calcium as well. We have the manual version of it. Now we're looking at how we can use AI agents even more. But AI agents can operate continuously. Unlike GPTs, they respond to your prompts, but AI agents, you can set it loose and have it think. So, for example, you can tell it, all right, I want to create. My wife and I are going to San Francisco next month, and I wanted to find 3 good restaurants that we can go to, while we're there to really experience San Francisco. And it'll go out there and do it. It'll then go out and do the research, scour the webs, look at Yelp, you look at, but then it'll ask us, it'll prompt us for questions. And this is something, GPT is slowly, now ChatGPT, by the way, is actually integrating agents into their system, but the core GPT is still the same. But what an agent will do, for example, will ask us, well, what are your preference for restaurants? Is there any special locations? And it learns from that content, that feedback you give it. And what it does, though, in the healthcare industry, is it enables scalable automation. It allows us to do more. And again, this is not going to replace healthcare workers, healthcare professionals. But what it means is that everybody's, with an AI agent, it's like every nurse, every doctor, every healthcare professional or employee is going to have their own virtual assistant, or maybe even a team of virtual assistants doing things for them. You could, in the future, you'll probably see this in the next 2 years, tell an AI agent, all right, please analyze this patient and determine whether or not they need to come in for another visit. And if so, go ahead and schedule it. And that AI agent will analyze the results, the lab results, records, and provide feedback to the physician or the nurse practitioner or whoever the provider is. And as long as they get an okay from the provider, this AI agent will then reach out to that patient and actually create the voices to ask them questions. And hey, we'd like to schedule a follow-up appointment. What's your availability? And then that patient can tell them, well, I'm available next week, Monday, between noon and 4 o'clock. And the AI agent will then look into the doctor's scheduler and see, well, the doctor has an availability at Monday at 3 o'clock. Can you make it? And if the patient says yes, that AI agent will then put that in that schedule the doctor, but then send confirmation to everybody, and then also notify billing or accounting about all of this. So again, that's the potential, and it's not really just potential now. It's happening. We're seeing more and more of it. But the key thing is you still need, even with AI agents, you still need touch points. It still needs to prompt back to either the patient or the healthcare provider before it is fully active. Now, I kind of created this table to kind of give you a better idea of what is the difference between generative AI, which is GPT, and agentic AI, which are AI agents. In essential, agentic is a key term here because you're giving AI agency to do more. It's more proactive rather than reactive. Where GPT is more reactive to what your prompts are. Agents can be more proactive. You give it, you kickstart it and then it keeps going. And it acts to proactively achieve goals. It can connect with, if you wanted to schedule a flight, it can go onto the Southwest airline website for you and schedule, find some flights, help you select it, and actually schedule it for you and put in your credit card for you. Unlike GPT, which handles simple regenerative tasks, agents can create and execute multi-step workflows that have different conditions and different forks. GPTs are mostly standalone, but agents allow GPTs and AI in general to interact with other apps, other APIs. It really is. And here's a big thing: is that GPTs, their learning is limited to what you train them on, the knowledge base, the library you give them. Agents have that, but then they learn from actions and outcomes. You can tell it to, hey, why don't you review, take my access to the New England Journal of Medicine and read everything you can in their library using my account about COPD, and then help me come up with some health literacy material. And it can do all that, but then all that information it digests or ingests from its readings that you send it on will actually build its knowledge base for you. It automatically will learn from that. And I like to joke around, sort of joke around, that really the big difference between GPT and agents is that with GPT, essentially you can have smart drones or smart apps talking back to you. Potentially with agents, this is where you get into that Terminator, maybe not necessarily fully self-aware, and but at the same time it can do more, it can create more, and it can actually potentially cause more damage if it's not properly monitored and supervised. So, in a nutshell, AI agents are really smart apps, and there's incredible potential for use. We're already seeing more and more of it, and you're actually seeing it already at work with ChatGPT and Gemini just behind the scenes. So it's really improved that basic GPT, and we're going to see more and more of this. We'll see AI agents actually do that adversarial AI we talked about earlier to double check the work of GPT, whatever GPT produces, and have it continually improve your own. If your organization has its own AI, for example, or GPT that is built out, you can use an AI agent to continuously help that learn and improve and build out. But again, the potential use case here is that it can really reduce provider and care team workload, and with that, provider burnout. It can improve your care plan adherence and patient engagement by doing the interaction, the guidance, engagement with patients. It's not just a one-way thing where you might a nurse might send a message or leave a message with a text message or a voicemail with a patient. An AI agent can keep doing that until they hear from that patient, and find out what's going on and get them, and that's one of the things that we strive for with our platform, is to keep patients on track. But also intelligent monitoring. One of the things that we're able to do on Calcium, for example, is we integrate with hundreds of medical devices and wearables, including your blood pressure, cuffs from Omron, or your Oura Rings, your Fitbits, your Pelotons, your Freestyle Libre CGMs, and all that data is coming in. What an AI agent can do, and this is something that we're also looking into and researching for 2026, is how to intelligently monitor that. Because right now we rely on healthcare providers to do the monitoring, but eventually we're going to have AI actually doing the monitoring and the recommendation. Now you still need that healthcare professional in that loop making the final decision, but it can simplify and do that while you're away from your desk or not at work. It can do that monitoring for you and enable more proactive interventions that prevent those readmissions that account for so much of our healthcare costs. One example of this is that we already have started working on is we can use AI agents to analyze patient EHR and generate care plans, convert those care plans into digital pathways, and then those pathways can absorb remote patient monitoring, health data, tracking data, whether it's blood pressure, whether it's weight, whether it's heart rate or heart rate variability rates, glucose levels. All of those things can come into play and be monitored by an AI agent, and then even potentially call the message the patient, say, hey, I noticed you haven't taken you haven't reported that you took your meds today, or hey, I see an uptick in your blood pressure. Instead of the nurse or a case manager doing it, you can have an AI agent do it and kind of track the response and alert the healthcare provider only at a certain level when when you set the kind of the alert system for it. But it can also eventually answer all your patient questions while you're asleep. At the same time, it'll always have a caveat that please, we'll need to run this by your healthcare provider, but here are some things to do. But please, again, if it's an emergency, contact 911. And again, all of this can come into play, and then all that data can get automatically added to your provider, database or your patient database. It could even generate those claim codes, and submit them to your insurer, and make sure they're accurate and reliable, and have everything taken care of. And then run predictive analytics to continuously update risk profiles. This is something, for example, we're doing for value-based care, is that we're able to, right now, a lot of predictive analytics is based on claims data. But one of the things we're rolling out in Q1 with the help of PulseData.io, they're a partner firm, is not just you look at claims data, but also look at EHR, historical health records, but then also your health data coming in from all of your wearables and medical devices and health apps to create more predictive analytics, or more precise analytics, but also update risk profiles so you have more accurate projections of which of your patient or population has the highest probability of needing readmission or hospitalization in the next 3 to 6 months, and what you can do to minimize those odds, or to lower those odds, to improve their compliance or their adherence to your care plans, so that you don't incur those high costs for readmissions. And again, the potential for money savings, but also better health outcomes for both individual patients and your population as a whole is really immense, especially with the help of AI agents. And so with that, I do want to talk about some basic recommendations for as we start to go into our Q&A session and closing out. And that's make sure some of you have already done this, as we noted in the polls, but make sure you establish an AI governance framework that your organization does and deploy only HIPAA-compliant environments. And the thing is, this is not an expensive thing. It can actually be pretty affordable. It does require some work, and if you use an outside agency, for example, for HIPAA compliance, most of them are now already employing this or including this in their training and certifications. And again, prioritize structured, validated tools. Have those templates. Build out your own library of what you want your GPT or AI or agent to prioritize. Enhance HIPAA training, as we mentioned, but this other one, you audit AI outputs for accuracy, bias, equity, and patient safety. You have to still have a human healthcare professional in the loop, making the final review and final decisions. At the same time, you can use AI agents to support health outcome goals with clinical oversight, but there has to always be human clinical oversight in this. And with that, I want to do another quick poll, and this is a little bit somewhat more personal, but again, it's still anonymous. How worried are you about how AI will affect your healthcare industry job?
Okay, you're seeing this up on your screen here, and we'll show the results here momentarily. How worried are you about how AI will affect your healthcare industry job? Are you very worried and concerned that it may eliminate your job, or maybe somewhat worried about the changes required for the job? Or are you not worried? You're excited about the potential to enhance the job, or maybe you're not sure. And then we'll show these results, and then we'll probably conclude here pretty soon as we're approaching the top of the hour.
Yeah.
All right, I'm going to go ahead and show the results here. Ray, are you able to see that?
Oh, interesting.
So it looks like about 54% of you are not worried at all, that you're excited about what's to come. 29% of you are somewhat worried, which makes sense. 8% are very worried. And another 8%, about an equal amount, are not sure. So it's a good mix, but it looks like most of you are actually excited. So that's a great thing.
Yeah. So, I do want to field any questions, and we don't have much time left. But while, if you have any questions, please do type it into the question column on the right. But while we're here, I do want to mention that now we're not sponsors to this. We're just attendees. We're exhibiting at this event. There's an AI and Healthcare Summit. It's going to be at the Bellagio in January 15th to 16th in Las Vegas. We did secure a discount code with this organizer, and also the Bellagio has a discounted rate of $159 a night. Now I did get word this morning that the block of rooms that they had secured are all sold out, but they're getting a second block of rooms to the Bellagio for those who want to join us at this event. This is going to be in January. If you are interested in AI and healthcare, again, this is Summit in January in Las Vegas. But with that, I do want to see if you have any questions, that we from the audience.
Yeah, let's see. We've got a couple. The first one is this. How can healthcare organizations balance innovation with risk, embracing AI tools like GPTs and agents without overwhelming compliance and IT teams?
That's a great question, and it's something that most health systems are already dealing with. The good news is that we've already been dealing with it. And I think we're a little bit smart about that. I mean, we've been dealing with technological change in the healthcare industry for the last 3+4 decades now, and we're getting good at it. And I think the same things still apply, that we have to have the safeguards. You have to have a committee or an oversight group to really pay attention to the risks and how to train our teams to be better equipped to handle those risks. And that's one of the things that we talked about here as well, is that, look, the risks are pretty apparent and clear for the most part, and a lot of the solution lies in making sure we have the right protocols and policies built out, and then also having the training. Because now in some cases, larger organizations are going to have their own AI, they're going to use their own GPTs, which is great. But even small providers who don't have, who haven't invested in that yet, as long as they have the training, you can still use publicly available chat GPTs, for example, but make sure you're de-identifying all, and really, watching how you use it for PHI, whether or not you're actually risking the release of PHI when you use that. You can still use it, but you have to be very careful.
Okay, great. And we realize that it's at the top of the hour. If you have to drop, but know that we're going to send you the recording here. Ray, did you want to take one more question, or should we just go ahead and
Yeah, I
wrap
think we
up?
can just wrap up now. And then again, if you have any
Okay.
questions, please don't hesitate to reach out to us. We'd love to talk to you. A little shameless plug about the Calcium Digital platform. We've kind of been talking a little bit about it, but we do have kind of 3 elements to our platform. One is Calcium Core for providers, and the Calcium app for individuals. As I mentioned before, we really designed this to be comprehensive, to be able to pull in data from all the major EHRs from pretty much every hospital and healthcare system in the country, plus data from your all your wearables and medical devices and health apps. But then with that, we have what's called Calcium AI Studio, and this is where the magic happens. It can recommend treatment and care plans for each patient, and then turn that, once you approve that recommendations or make edits to it, you can turn it into a digital pathway that's assigned to the patient's app to continuously guide them. Again, this is a force multiplier for healthcare providers and organizations. And if you want to learn more, you can actually just go ahead and go live with our self-service Go Live program. Just go to Calcium Health, and you can go on and get a 30-day free trial and learn more about it. It includes onboarding and training. Or you can, if you have more questions about it, you can schedule a demo with one of our account executives to really deep dive to see how it can answer specific questions and challenges you and your organization might have. Now, with that, I do have some key takeaways. I'm not going to go too much into this because I think we've already seen this, but again, it's clear that GPT and AI agents offer significant value, but human oversight remains essential. AI should augment, not replace clinician judgment. And be careful of HIPAA compliance and secure platforms, because ChatGPT and other GPTs, without the right protocols and the right settings, are not HIPAA compliant. Structured system and clinically reviewed pathways remain the safest way, and AI agents can dramatically improve efficiency and value-based care performance. But we got to operate within strict governments to ensure safety, patient safety, and reliability. Again, this is my contact information. I look forward, if you have any questions, please reach out, connect with me on LinkedIn or via email. And Garrett, you want to close us out?
Yeah, sure. Thanks, Ray. And by the way, all of this will be in the slides. We're going to send out, for those of you who are still here, we're going to send out a link to this recording as well as to all the slides, so you can download those and go through, and you'll be able to get Ray's information there. But as we close out, I wanted to encourage you all also to head over to vbcexhibithall.com and check out the virtual exhibit booth that we had set up for Calcium there. There's some really cool resources here that they provide. You'll be able to look around and educate yourself, do a little bit more reading up on them, and of course, reach out through there. And also in the library at vbcexhibithall.com is where this webinar is going to be archived. Along with the other webinars that we've done with Ray and his team, and on a huge variety of other topics as well. So if you would like, and all of them are free to access, and would love for you guys to go and make use of those. But I want to thank you all for your time today. Thank you, Ray, for a very thorough and fantastic presentation. Really enjoyed it personally, and hope you all did as well. And we will see you on the next one. So have a happy rest of your month and holidays as they are coming up here soon. Bye-bye now.
Bye, everybody.